people can tell you it is a terrible allergy season. I know I've been sneezing a lot, and the long cold winter is only making that pollen worse. So today, pharmacist DJ Lees is here with Andy Matherin from the Apothecary Shoppe with a solution that can do much more than a standard nose spray. What are you seeing, first of all, this year compared to maybe last seasons? Is it really bad this year like we talked about?
Certainly is. Andy's out in the field all the time, and he hears it from doctors what's going on right now. So let's turn that over to Andy.
We have a lot of physicians out there that are telling me that they're patients with face pain, they're sneezing, they're coughing, which is obviously affecting their sleep at night. So these patients are exhausted right now with everything that we have out, especially here in Oklahoma.
And sometimes if it is really bad, it seems like there's nothing that you can do for it. What can you offer at the Apothecary Shoppe that is different from regular traditional prescriptions or over-the-counter medications?
Well, let me tell you a little bit about the Apothecary Shoppe. We are Tulsa's compounding-only pharmacy. We provide a unique, customized approach to help patients' outcomes and affect their quality of life. Areas that most viewers might be familiar with are hormone replacement therapy, advanced pain therapy, sterile preparations, and of course allergies. And what we're talking about today is the nasal nebulizer. And
nasal nebulizer. So this is the graphic. What is this explaining here about the nasal cavity?
So you see the picture of the nose with the blue. That is a typical nasal spray preparation that on the market, like you might get at a traditional pharmacy. It just delivers the medication directly to the nose and a portion of the sinus cavity. If you look at the pink picture there, where the sinus cavity is highlighted in pink, that's where the nasal neb will actually deliver the compounded medication directly to the entire sinus cavity, where allergens can certainly attach to the sinus and cause their effects.
So basically, this looks like it could be a lot more effective for a lot of people.
Typically, we see some pretty good results from our patients.
I'm glad that you tested this during the break, by the way, because I had no idea how it worked, and it scared me at first. Will you kind of explain how this machine works?
Sure. Okay, so essentially this is just a shower for the nose. Obviously, people have that face pain. It's kind of like a wildfire through the inside of their face. And if you see this, that's what they're getting. They're getting the medications delivered straight into their nasal cavities.
So you actually put your nostrils, if you want to tilt it, you can see the little two little nubbins there. You put your nostrils in there and then it just...
Absolutely. It gets the medications, the prescribed medications from your physician to where you really need it to go, and it gets to all those areas effectively.
Wow, that is so cool. Has this been around for a while? I had never seen one of these before.
The machine came out around in 2012, so it hasn't been out around a very long amount of time. We're out educating physicians on how we can utilize this machine in combination with a customized medication for each patient to positively affect their allergies.
How does this work differently from, say, a nasal rinse that you would get at, the grocery store? I think I've heard the neti pot where you have to do it yourself, and it's hard for some people to do. I can't even do it.
If we remember the graphic that we saw on the screen, the pink picture depicts what this would actually cover. However, a nasal rinse really would just go wash over part of the sinus.
So even those two, it's still not getting.
It's not covering the entire cavity like one would see with a nasal rinse.
Now, how do you know if your allergies are bad enough to where this would be something that you should consider and come in and get?
Well, typically, the side effects that we were talking about earlier. There's no reason to not utilize a medication with this machine. So if a patient is experiencing problems and they've failed their medications that their doctor had prescribed first line, it's certainly a great option to go with. But I don't have a reason to tell you why it shouldn't be a first-line therapy as well.
Wow. So you can come in and you go over specifically that person's needs, what their problems are, and you compound a cocktail personalized to them specifically.
Specifically to them in the combination with their doctor.
Do they need to make an appointment if they want to come in? How does that work?
Well, typically the patient needs to go see their physician first, and if they don't have a physician, they can certainly call us and we can refer them to a local area physician that utilizes this medication. So that's something that we have the ability to help steer our patients to the correct physician if they don't already have one.
Very interesting. Now, how long does this take really quickly? the
So
whole
it's
process.
1 to 2 minute delivery system.
Just 1 to 2
yeah,
minutes.
That's it. That's it.
Awesome. If you're having trouble, this might be something you want to try if other things aren't working for you. Thank you guys
Yeah,
so
thank
much.
you
very much.
The Apothecary Shoppe is also sponsoring Keith's Ice Cold Lemonade Stand this summer, and they will have lemonade stands at their 2 locations, 51st and Sheridan and 74th and Elm, every Wednesday starting June 18th. All of the proceeds benefit the Little Lighthouse. Well, gardening advice, Tulsa's most beautiful blooms, and even some green goodies, where you can find it all in one place next weekend. And are you in the market for a new house? We're talking home trends and tips right from the experts coming up.